You heard that we are here this evening for a call to action. We're also here this evening to start a revolution. We need a revolution, ladies and gentlemen, in this country in the worst way, in terms of our health and wellness.
When we talk about the problems that we have in dealing with this HIV and AIDS, we have to talk about substance abuse, because the IDU or the intravenous drug users account for a large percentage of that. When we talk about the populations, it's still men having sex with men. Second on that list is IDU. The women, African American women, are all mixed up in that, because we have this thing called a down low, where my brothers who go into the jail, they get to having sex with each other in the jail, and then they come back out and they hook up with their wives and their girlfriends. Or the dudes that's out on the street selling drugs right up and down this corner, you know, down 7th Street, Searching Quarters, Simple City, Potomac Gardens, Bird Farms, whatever you want to talk about, again, are talking about the fact that, you know, this is a hustle for me. I gotta sell drugs to make money. Well, people come to them to buy drugs and they ask them to do sex acts for them. And I'm talking about men doing sex acts for men. Y'all know about this though, right? Hello? Do y'all? Okay, the question becomes, as my sister stated, what we're gonna do about it. I'm gonna close out with this particular list that we wanna read. It's called the list. The most destructive habit, worry. The greatest joy is giving. The greatest loss, loss of self-respect. The most satisfying work is helping others. The ugliest personality trait, selfishness. The most endangered species, dedicated people. Our greatest natural resource is our youth. The greatest shot, injection in the arm is encouragement. The greatest problem to overcome, y'all, is fear. The most effective sleeping pill is peace of mind. The most crippling failure disease is excuses. The most powerful force in life, love. The most dangerous pariah, a gossiper. The most incredible computer is the brain. The worst thing to be without is hope. The deadliest weapon is your tongue. The two most power-filled words is, I can. The greatest asset, faith. The most worthless emotion is self-pity. The most beautiful attire, the beautifulest thing you can wear is a smile. The most prized possession is integrity. The most powerful channel of communication is prayer. And the most contagious spirit is enthusiasm. So I say to my brothers and sisters in ending, that it's up to us, and to heal the people is to help heal the world. As a community, we are united in our struggle, and we say yes to life and no to the things that threaten to destroy us. Thank you.
In order to have decay and periodontal disease or gum disease, the three factors that we have to have present. One is, first of all, a tooth or the gum tissue. We all have that. The second is plaque. Plaque is a soft film of accumulation of food residues. And the third thing we need is bacteria. And we all have bacteria in our bacterial flora. Our digestive system needs bacteria for proper functioning. So these three things, we have to limit. If we could eliminate one of them, then we're going to cut down on oral disease. So we cannot eliminate the teeth because we need our teeth for chewing, for talking, for all the functions that we use them for. We cannot eliminate the bacteria because it's part of our bacterial flora. But we could eliminate the plaque. And that's why brushing and flossing is very important. People ask me how many times should I brush and floss? I answer with a question. How many times do you eat a day? If you eat 10 times a day, including snacks, you should brush after every meal. It's been proven that for 20 minutes after you eat a product with sugar, acids are going to affect your teeth. I tell people, treat your teeth like you treat your car. Every 3,000 miles you change the oil, get a tune-up. That takes time and a bit of money. Also, your teeth. Take the time, visit your dentist. The dentist, all we could do is restore. We could educate in prevention. But it's up to each of us to be able to take care of our oral health care by good nutrition and good oral hygiene. It's very important to smile, because when you smile, the world will smile back to you. Thank you very much.
we discuss and celebrate our having endured and eventual triumph over the institution of slavery. But what I want to tell you tonight is that victory is not yet complete. In some respects, echoes of our enslavement is still with us. Though valid, I am not referring to the socioeconomic issues which resulted from slavery and its aftermath. I'm referring to our diets. When blacks were captured in Africa and dragged over here, we were forced to eat a diet very different from traditional West African cuisine. We were force-fed the refuse of the plantation: pig ears, pig feet, oxtails, entrails, and so on. Unfortunately, when we were released from slavery, we turned around and embraced a legacy that was not ours. We owned this enforced refuse-centered diet and called it soul food. So you see, ladies and gentlemen, the last vestiges of slavery can be found on our plates. But this is not soul food, it's plantation food.
We deliberately had a very holistic panel, because when we talk about healing and health and wellness and wholeness and holistic, you've heard that a lot tonight. We're talking about integrating it all. Integrating all of the acupuncture, reflexology, herbal medicine, with conventional medicine. You don't do just one or the other. We take the best of all that God has put on this earth for us, okay? So that's why it's important that we have this whole range of practitioners up here for you talking about it in a very holistic way. Before you can even begin to exercise, to make the changes you have to do in terms of eating right, etc., controlling your stress, managing it every day. And these are things you have to do every day. It has to be a daily. You can't just do it for the next 2 weeks. No, it has to be for the rest of your life. These total changes have to be for the rest of your life. First of all, just as she's saying, look at TLC, this is me. Prioritize your health and yourself first in your lives. You have to begin to make a commitment to your health every day, from the moment you wake up till the time you go to bed. You know when they tell you when you get on these airplanes, what? Put your mask on first before you put it on anybody else. You see, we're so busy taking care of everybody else, we're last on our list to do. Our to-do list, okay? We have to reverse that, because we can't do a good job taking care of everybody else if we're not fit. So first of all, change that paradigm, that you're going to care for yourself first. And these changes are very hard. There's no question about it. I'm still trying to get my mind around the fact that my serving size is my palm of my hand, and that's all the grits I can have. I'm still trying to deal with that, okay? All right, I'm finally exercising 30 minutes a day. But this nutrition I'm struggling with, I just put into my daily routine a stress management program the past 2 years. I can't tell you what a difference it has made in my life. All of you need to do that immediately. The last thing I want to say is, they're so hard to do, get some support, okay? When you can do this with buddies, more and more information is showing that you can make these lifestyle changes if you do it in groups. We have now started what we're calling sister circles, groups of women 8 to 10 that are making these preventive lifestyle changes together. And I can't tell you the difference it's making in their lives in terms of it's easier to make these changes and it's more sustainable. They keep them in their lives longer. So remember to do that. This really thanks Abdur-Rahim for this evening's